It's time for Health segment, and joining us now is Africa 54 Health correspondent Linord Moudou with a look at what we need to know about uterine cancer. Hello, Linord.
Hello, Esther. Indeed, we are looking at a uterine cancer, and it develops inside a woman's womb. June this year marks the inaugural Uterine Cancer Awareness Month globally. Data show that over 400,000 people were diagnosed with uterine cancer worldwide in 2020. According to the International Gynecologic Cancer Society, IGCS, the incidences of uterine cancer continue to increase by almost 2% per year in women younger than 50 and by 1% per year in older women. During the month of June, IGCS is increasing the awareness and raising resources toward cancer of the uterus. For more insight, I spoke via Skype from Miami, Florida, with Dr. Brian Slomovitz. He's a director of gynecologic oncology and chair of the IGCS Uterine Cancer Awareness Month initiative. Take a look.
Now, most cases of cancer of the uterus arise from the inner lining or the endometrium. However, about 4 to 5% actually arise from the muscle, which is called sarcomas. Sarcomas are tumors that arise from the muscle, and they could be very deadly as well. So to answer your question, uterine cancer encompasses everything, but the most common type of uterine cancer is endometrial cancer.
And the data show also that it is on the rise among Black women in particular. How and why?
And that's something that we've been trying to figure out. Now, originally, we thought that the cases in underrepresented populations, particularly Black women, part of it we thought was due to access to care. That's not the case. We're seeing these patients, they're being treated in academic centers, and we're happy about that. What we're learning, however, is that the biology of this disease is different. There are more different types of genetic mutations, which make them more aggressive type of cancers. Therefore, these aggressive type of cancers, what we're learning, increases the deaths due to this disease. Black women are twice as likely to die from endometrial cancer than any other population. So we need to do better. And to do better, we need to do a couple of things. Number one, we need to know what the biological differences are. Number two, we need to determine if our current therapies that we offer are correct across all patients. Because there's a difference in biology, maybe we need to come up with different treatment options to better treat those patients, really regardless of race, but race is one of those factors. Maybe we need different drugs. And three, we need to figure out why, with our current treatment options, are certain populations, including Black women, not responding to therapy as much as we would like. Other reasons in general for the increase in endometrial cancer, obesity, fat tissue, adipose tissue, which we all have, increases the estrogen levels in the body. And it's that increased estrogen which stimulates the lining of the uterus, which causes cancer.
So what are the signs and symptoms to be aware of when it comes to uterine cancer?
When we're talking about the signs and symptoms, we're fortunate. It's not like ovarian cancer, which it presents an advanced stage. For uterine cancer, we often see postmenopausal bleeding in our patients that are postmenopausal. We do see this disease happening in premenopausal women. So then the answer there is abnormal uterine bleeding, heavy periods or bleeding in between periods. Pelvic cramping, pelvic pain, pap smears. Pap smears, we know, decrease the incidence of cervical cancer, but they can also identify endometrial cancers. So it's important to do PAPs for a lot of different reasons. Bladder pressure, bladder pain, advanced stage disease, may have abdominal pain, cough. The key is if they have postmenopausal bleeding, don't wait for their annual exam that's going to be in 3 or 4 or 6 months. Go to the doctor sooner. And then the doctor's basically going to say, we need to do a biopsy. Endometrial cancer is a tissue diagnosis. So the biopsies can be done right there in the office with an endometrial biopsy, or they can be done through a procedure called a DNC hysteroscopy. Endometrial biopsies are a blind procedure, basically sticking a straw into the uterus and taking some tissue, or hysteroscopy is done under direct visualization. It's the pathologist that'll then tell us if it's a diagnosis or not. If it's a cancer, then the first step is to talk to the patient, obviously, explain to them that it is very treatable in a lot of women, but it needs to be treated seriously. We then do imaging, and if the imaging's all clear, then we go forward with a hysterectomy. Now, fortunately, we're doing a lot of these minimally invasive with the robotics. So patients are doing much, much, much better, getting out of the hospitals the same day, recovering a lot quicker.
IGCS and partners have announced the month of June as the Inaugural Uterine Cancer Awareness Month. Why was it important to have an awareness month?
For a couple of reasons. In general, people need to know about this disease. As I mentioned, it is the most common gynecologic cancer. There are, hundreds of thousands of women worldwide who get this cancer. So we need to make it a global initiative to make people more aware. And what's the advantage of that? If it was a disease that we couldn't affect the outcome, then, we want to make people aware. But endometrial cancer is not like that. If we educate people on prevention, decrease weight. If we educate people on the early signs and symptoms, go to your doctor as soon as possible. What we feel, and what I'm certain of, is that we will decrease the number of deaths due to this disease because people are going to become more aware, and they're going to go to their doctor on their first episode of bleeding, not allowing the disease, the nasty disease, to spread. And how are we going to do that? Through education. How do we educate people? Through Awareness Month. Peach is the color of Uterine Cancer Awareness Month. It's a year-wide educational opportunity, research opportunity, but we're committed to June to raising the awareness. We want it to be a sustainable initiative. We want it to happen every year. And the buy-in that we've had, the commitment we've had to groups has really been incredible. And there's a lot of interest there.